This is my patient Adrian Martinez. He's a famous power lifter. My name is Dr. Visentin, and I wanted you to see what chiropractic is really about. I'm going to make sure he's nice and relaxed, and I'm going to touch his feet and make sure that he's well aligned. And we're going to do several tests together. Put your right hand on your lower back, please. And when he puts his hand on his lower back, his right leg shortens up, which tells me his back is crooked. So I'm doing some tests to determine where he's out of alignment. And I'm pushing on his pelvis, checking out his feet. Right hand to the side of your head, please. Arm back to your side, turn your face to the right. Head in the center. And he's been doing some heavy lifting. Lift your head up. And he's been getting into great shape. Tuck your chin in. Look over your left shoulder, please. But he's got a neck bone that's crooked and a lower backbone that's out of place as well. Please lay on your left side and turn and face me. He's been doing some squats and deadlift, right?
Mm-hmm. Yes.
Take a deep breath. Exhale, exhale. There we go. Set that lower back. Go ahead, lay on your back and face up, please. How'd that feel?
It felt good.
All right. People wonder if chiropractic might hurt, if it might hurt to get adjusted. What would you tell them?
No, it doesn't hurt.
Feels good. Feels good, right?
Feels good,
right.
yes.
Relax your head and neck. Here we go. When you can, look over to your left, let your head just go, let this muscle just relax. That's beautiful, man. So you adjusted like a champ. And I want to check your legs again and make sure everything's lined up perfectly for you, because I know you're going to put it to the test. But that looks pretty good. Is there anything else you'd like examined in particular today?
No, thank you.
I'm going to lift you up. Take a deep breath in. That's good. How did you feel coming here? What kinds of pain did you have initially?
Initial pain when I first came here to the chiropractor is I was having a lot of numbness down my legs, and I couldn't stand for long periods of time. I was having a lot of pain in my lower back. It's been probably like 5 or 6 months since I've been coming, and I don't experience the numbness down my legs anymore. Every now and again I have tightness in my back, but that's due to me working out quite a bit. We're doing a lot of 5K runs, a lot of working out and stuff like that. But as I come to the chiropractor 3 times a week and get adjusted the way you adjust me, it helps me through my workouts. It helps me through, the strenuous day that I have at work, and with my workouts, because I'm a pretty active person. Without no pain, when I'm standing at long periods of time, I don't experience any kind of pain. As of recently, the heel thing's been kind of helping a bit.
So you got a heel lift.
So I got a heel lift in there.
That's
so
smoothed out the way you walk.
Smoothed out the way that I walk. That's
Great.
correct. I'll know more about that in about a couple more weeks to see how that feels, for the long term, and I think that would help me, for the most part.
Sure. And what would you tell someone who's afraid of getting adjusted or afraid of going to the chiropractor, doesn't know anything about it, and maybe they've got some pain but they're reluctant to go? What would you say?
As far as, I was kind of skeptical when I first started coming to chiropractic. I just heard a lot of negative stories about chiropractors, and stuff like that. But my experience here has always been good. My experience coming to the chiropractor, it's not a negative outcome. It's always a positive outcome. The chiropractor's here to help you and adjust you, always asking you questions on what kind of care you need and stuff like that. And I think it's a good experience. It's nothing to be scared of.
Thanks for your testimonial today. You're doing great.
Thanks, I appreciate it, Doc.
You're welcome.